Hey, one of our favorite things doing this program in 125 million TV homes across the country, plus, of course, Bloomberg, El Financiero, and, of course, American Forces Network, like Mike said, is when we get shareholders calling Greg and say, you got to feature this company.
Right.
So this company is what? It's Immunic? Am I saying it right? Immunic Therapeutics?
IMUX
there we go.
is the ticker.
So we got Dr. Daniel Vitt here, the CEO. That's how important we are. And we get a chance to talk to an actual CEO of a public company. They are publicly traded. I'm sorry?
PhD.
Yeah, doctor. I said doctor.
Yeah.
I am. MOUSE. IMUX is the symbol. Dr. Vitt, great to have you on the program. How are you? You didn't know what you're getting into, did you?
Hi, good morning. Happy to be here.
Great to see you. Hey, can you talk to us? So JP Morgan, the biotechnology in the biopharma space the last 2 years has been beaten down, and this is a technical term, like a redheaded stepchild. And JP Morgan Chase came in January and said, this is going to be the year, but you're not going to be able to raise money for the first quarter. Suddenly, second quarter this year, biopharma firms were able to raise money, but suddenly the faucet got shut off, and now you guys are in this interesting dilemma where there's all these great biopharma companies that are going to change the world, but for some reason, it's been a difficult 3 years. Where are we? What's the landscape look like right now?
Well, and maybe first talking about where we are, I think we were able to raise some money beginning of the year, and we have a program. We have a program in clinical phase 3, so in registration studies. So we see the finish line. Therefore, I think we're doing quite well. But of course, drying out of capital in the whole environment is of course a challenge to the whole industry. But on the other hand, our friends at Big Pharma, they need new innovations and new stuff. And therefore, I'm very optimistic, specifically looking forward for the next year, 2025.
Talk about Immunic therapies. What are you guys trying to take on here? And are you guys looking at the FDA sort of arc of that story? It looks like you're at the finish line. Talk about what you guys are working on.
Yeah, we have our most advanced program is, as I said, in a registration study called vidofludimus calcium. It's a new medicine which is aiming to really change the way we treat multiple sclerosis. And our approach is with a new mode of action. And in contrast to historic medicines used, they are mainly targeting so-called relapses, specifically in relapsing forms of MS. Our drug also is believed to have neuroprotective effects. So more or less really focusing on the key unmet need of patients with MS, which are aiming to really prolong as good as possible the time of independence of life.
You know, Daniel, it's interesting because one of the reasons we have you on is my eldest daughter has MS, and so does my mother. And it is quite different. You know, my mother, you know, the symptoms have gone to the point where she's got a lazy leg, but she takes a daily dose of medicine. My daughter goes in for infusions twice a year. Does this change the quality of life for MS patients, or does it just work better? Talk about the differences between you and what's currently there.
Yeah, I think there are different ways to treat it right now. Each drug or each medicine has a benefit or a disadvantage. I think the infusions twice a year, it's good for some time. The problem is these are B-cell depleting therapies, which mean they really, on the long run, lower the immune system. And what we are developing is a drug which, on top of really a benefit, because if you're young and you are diagnosed with MS, you want to stay as long as possible in your independent life, and therefore we need therapies like the candidate we are developing, which are aiming to really stop progression or slow down progression.
Dr. Daniel Vitt, the CEO of Immunic Therapeutics. Their ticker symbol is IMUX, with us here on the Big Biz Show.
By the way, imux.com is their website.
IMUX.com. Dr. Vitt, does MS normally present itself early in a person's life, or is there any spectrum people can get it?
Yeah, unfortunately, it usually affects mainly women at usually young age, so in the second or third decade of life. It's somehow related to infections with Epstein-Barr virus earlier, so it's a little bit unfortunate situation. So it affects patients for quite a long time during their lives.
Hey, talk about your top line drugs. So Jared Coleman, our Emmy Award-winning director, can pull up that chart. So if I look at the FDA sort of timeline, you have a top line drug that's close to the finish line here. Talk about
Yeah.
what we're talking. Where are we at with this, and how close are we to actually presenting this to market?
Yeah, I think this is a typical development of a drug. So we succeeded in getting it through a very good phase 2 study 3 years ago in relapsing forms of MS. And based on that, we started a big phase 3 study, or basically 2 phase 3 studies, which are currently ongoing and recruiting. And these studies here in phase 3 stage are planned to complete in 2026, so not too far from now. On top of that, and I think it's an important thing, we're testing the same molecule in progressive MS. And in progressive MS, these patients don't have relapses, they just progress with all the disadvantages of that. And we will read out a phase 2 study, which covers basically all forms of progressive MS already next April. So there's some news coming from the company 25, but also 26.
So are you optimistic about 2025 in terms of where the pace of this is going for you? And I guess the second question is, what's the strategy to get it to market? Do you partner with a larger pharma firm, or do you take it to the goal line yourself?
Well, first of all, I think what makes me excited, and of course, I'm optimistic. It's a great drug, and we have already generated a lot of data during development, which makes me confident about that. Regarding commercialization, of course, it's a big indication affecting hundreds of thousands of patients. And there are different ways to do that. We on the one hand, we are talking to big pharma companies. We also talk to mid-sized pharma companies in Europe, in the US.
Well, listen, I got selfishly, I want to have you back on the air with us because it's promising.
Yeah.
And to watch, my mother sort of digress, but she's also 86 years old. But McKenna, 31, is living a healthy life, and what it did, it scared the crap out of her. She got in shape, she lost a bunch of weight, and I'm looking forward to other therapies to come up. Hey, listen, Dr. Vitt, come back with us on the air. Love to talk to you. Appreciate that. Immunic Therapeutics, IMUX is the stock symbol, and IMUX.com is the website.